Let me just confirm whether audio video is clear or not. I'm just opening this thing, chat box. So after that we can continue. So here we are. Okay, perfect. Hope I'm audible. Just let me confirm. Okay, perfect. Audio, video, everything is fine. So good evening, everyone. Welcome to today's session upon biochemistry. So today we are going to discuss the most expected 10 questions. So how do you guess this question? So this is just a guesswork. It's not just a plain guesswork, my dear students. Rather, what we do is that, so these are the questions which are previously asked topics. These are the topics which are previously asked. Okay. So based on that only, we are going to discuss about what is that, discuss about the topics. Okay, so here what I'm going to do, I'm not going to do the discussion of the whole this thing, what is that whole topic itself. Rather, within a crisp time of 20 to 30 minutes, I'll discuss all these 10 questions with all the important surroundings and what are the possible MCQs which can be asked. Okay, so hope I'm audible and clear, everything is fine, I'm guessing. So just if you are not able to hear the live, if you are feeling it is lag, just fast forward it a little bit, it will be fine. Okay, so good evening everyone. Or you just close the video once and open it once again. I think we will be in the live. So good evening. I'm starting the topic discussion now. So a neonate with a vomiting and hypoglycemia. All right. After a fruit juice intake, which enzyme is deficient? Perfect, perfect. Okay. Now see, he's having a hypoglycemia. Very nice. Okay. Hypoglycemia. So hypoglycemia, if it is there, along with that, he's having vomiting after the fruit juice intake. After the which intake? Fruit juice. So fruit juices, my dear students, they will contain one substance. The name of the sugar is called as fructose. What is the name of the sugar called as? Fructose. So this fructose undergoes the metabolism by some enzyme. The first enzyme which will come here is that fructokinase. What is the name of the enzyme? Fructokinase. What is the name of the enzyme? Fructokinase. Fructokinase will further lead to the formation of fructose 1 phosphate. This fructose 1 phosphate will get further converted into fructose 1 comma 6 biphosphate. Yes, biphosphate. And followed by that, this will undergo the influence of an enzyme called as aldolase B, my dear students. What is the name of the enzyme? Aldolase B. It will give us two important products. What are the two important products we are going to get? One is your diacylglycerol. Okay, so there is one more there, so that is hydroxy acid. But among which, what is the important key point? The enzyme aldolase B. So the deficiency of the enzyme aldolase B, will impair the metabolism of fructose 1 comma 6 bisphosphate, which is coming. So if that is not there, the child will develop, what is that? That will be hypoglycemia and also your vomiting. So it is a HFI, my dear students. It is a HFI. What is HFI? HFI is nothing but hereditary fructose intolerance. Very good, my dear students. You people are absolutely correct. Good evening once again. Aldolase B is the absolutely correct answer. Here, what are the other possibilities they can give you? They can give you what is the diagnosis? That is the HFI, hereditary fructose intolerance. The deficiency of the enzyme is aldolase B. Aldolase B. Okay, deficiency of the enzyme is aldolase B, and most importantly, the gene which is defective, my dear students, the gene which is defective is ALD, aldolase B gene. What is the name of the gene which is defective? Aldolase B gene, ALD B gene. This is also a possible MCQ. How can they ask you is the same question they will give you, which of the following gene is defective? If they ask ALD B gene, my dear student, which gene? ALD B gene, which gene? ALD B gene. Okay, then the next important aspect, here is the enzyme fructokinase. So fructokinase, my dear students, what it will lead to? It will lead to a deficiency, will lead to a disease. The deficiency, it will lead to a disease called as, yes, essential fructosuria. What is the name? Essential fructosuria. Essential fructosuria is the condition which is caused by the deficiency of fructose kinase. Okay, so here the perfect answer will be aldolase B. So aldolase B will lead to hereditary fructose intolerance. The symptoms are more aggressive and more visibly seen. Okay, more visibly seen with which disease? HFI. Only fructose in the urine will be elevated in which condition? Fructokinase deficiency. Okay, so galactokinase and UDP galactose epimerase, they play a role in which metabolism? They play a role in galactose metabolism. Which one? Galactose metabolism. Right? So this is the story of your, what is that? Very good. Correct answer. That is a fructokinase deficiency will lead to that is only essential fructosuria. Let's go to the next question. Which of the following substances accumulate in the lens in a diabetes causing the cataract? This is a very, very commonly asked question which many students will get confused. So let me clear that. Okay. So please listen to me. Diabetes mellitus patient. Diabetes mellitus patient will have what? They will have a increase of blood glucose. Increase of blood glucose. Okay, now many students are getting confused. Why they are getting confused? So normally glucose will enter into one pathway, right? That is only where, that is a glycolysis pathway. But listen to me very carefully. Let me give you a comparison. In a normal individual, normally glucose whatever is there, it will undergo glucose whatever is there, it will undergo glycolysis, giving pyruvate. Giving what? Okay, so very good answer. All of you are absolutely correct. The answer is B. B is absolutely correct answer, sorbitol. But how sorbitol? For those of you who don't know, let me tell you people. Okay, so pyruvate will further get converted into acetyl CoA. What is that? Acetyl coenzyme A. So this acetyl coenzyme A enters into one cycle called as TCA cycle, which is also called as tricarboxylic acid cycle, which is also called as, very importantly, Krebs cycle, right? So Krebs cycle occurs in the mitochondria. These are whatever the single line I'm telling you, all these are important MCQ. Don't think only this question. So the purpose of this session is to give you a recall of all the important points. ओके ऐसे ही सर ये 10 क्वेश्चन पढ़ लेंगे तो बायोकेम हो जाएगा, समझ बोलो यार, बायोकेम तो बहुत काफी बड़ा सब्जेक्ट है. सो व्हाट आई एम ट्राइंग टू कन्वे यू पीपल इज अ सिंपल फंडा. दैट सिंपल फंडा इज, सी we have this particularly pyruvate is getting converted into acetyl. So the first question is, pyruvate to acetyl CoA conversion occurs in the presence of oxygen or in the absence of oxygen? In the presence of oxygen, and there should be one more thing that is only called as mitochondria. Okay, so in the mitochondria only tricarboxylic acid cycle will also occur, and this is also previously asked question. What is that? What is the location of the Krebs cycle? They have asked. What is the location of the glycolysis? They have asked. Okay, but if there is a excessive glucose, now increased glucose, excess glucose enter into alternate pathways. Okay, normally it is supposed to enter into pyruvate metabolism, but rather than entering into the pyruvate metabolism, enter into the alternate pathway. What is pathway? Alternate pathway. So once it enters into the alternate pathway, now here is the main problem which you are going to get. It will give a metabolite called as sorbitol. What is the name of the metabolite? Sorbitol. This sorbitol will get deposited. It will get deposited where, my dear student? Deposited in the patient cataract. In the cataract of which patient? Diabetes mellitus patient. So excessive sugar, excess amount of sorbitol accumulation leading to cataract. So that answer is sorbitol. Very good. Absolutely, people are correct. But why, sir, all these questions, so we know answer, but you need to know a little bit about confusing terms. Second, give mannitol. Mannitol, you're going to get confused on the day of exam. Normally you won't get confused. You know that mannitol is a diuretic, but now you should not get confused. That is sorbitol, and mannitol is a osmotic diuretic. Bacho, osmotic diuretic. Okay, now this xylulose is a type of pentose sugar. It's a type of pentose sugar. Pentose sugar means how many carbon containing? 5 carbon containing sugar. What is that? 5 carbon containing sugar. So this pentose will be increased in the urine, increased in the urine. In which condition, my dear students? In a pentosuria. In the pentosuria. So this was also previously asked question. So in the patients with pentosuria, they are going to get what, my dear students? They are going to have a urine elevated level of xylulose. This is the story of your, what is that? That is diabetes mellitus and what happens. Okay. So this is a very basic question, how they can ask you. So what is that? The classification of the carbohydrate. So let me quickly tell you people about the classification. Classification of carbohydrate is classified into monosaccharide, right? We have a disaccharide, okay? Then we have a oligosaccharide, and we have one more thing. What is that? Polysaccharide, right? So monosaccharides are the sugars. We cannot break them further into one more sugar. What do I mean by this? Please listen to me. For example, I will take one substance. The name of the substance, I will call it as lactose. Okay. If I break this lactose, my dear students, I'm getting two more sugars. What are the two more sugars? I'm getting galactose. Okay. Very good. Whoever is telling the answer as A, you people are absolutely correct. But those who don't know, just go through this quickly. Galactose, and also it will give glucose. So basically, when I break this large sugar, it gave me two smaller sugars. Okay, so that type of sugar I'm going to call it as absolutely, whoever told the answer A is absolutely correct. Okay, M's, that's strange. Okay, Sangeeta, Rishi, all of you are absolutely correct. Okay, so now lactose is there. Now lactose broken into galactose and glucose. Okay, now if I take glucose, I cannot break it further into any sugar. Means if I hydrolyze it, I am not getting any further sugar. So basically monosaccharides are the type of sugars. They are non-reducing sugars. So basically monosaccharides is a single sugar. If you break it, you are not getting any carbohydrate, means you are not getting any sugar further, rather you are going to get some other chemical. Okay, disaccharides will contain two monosaccharides. Oligosaccharide usually will contain more than or equal to 2 till 9 monosaccharide. So here polysaccharide will contain more than 10 monosaccharide. So polysaccharides are further divided into two types. This is also a previously asked question. Polysaccharides are called as homoglycans. Homoglycan means if it is made out of same sugar, means if you take the chemical structure of a homoglycan, if you read the monomers, means single building blocks, in that all of them will be made out of same sugar. The classic example you have is, my dear students, glycogen in the human body. So we have heteroglycans. Again, heteroglycans, I have told you people in the class itself, there are lots of heteroglycans which has been previously asked many times. Heteroglycans, the examples, I'll go through them quickly. Just listen to me. We have dermatan sulfate, we have heparin sulfate, we have keratin sulfate. Okay, we have hyaluronic acid. Their locations also very important. So among the given options, only one which cannot be further hydrolyzed is glucose. All others can be hydrolyzed into smaller sugar. Whoever told the answer as A, you people are absolutely correct. Okay, and this is examiner's favorite topic. Okay, so what is that? Casal's necklace. Okay, which vitamin deficiency causes a Casal necklace? Okay, so Casal necklace. Casal necklace is the condition. It is seen with the one important disease, that is only your 4D disease, you call it as. What is that? This is due to Casal necklace seen with which condition? Come on, quickly batao, cho. Which disease? Come on, quickly. Let me see if you can answer. I'm waiting for your comments. So answer is vitamin B3. Very good. Answer is vitamin B3. B6 nahi hai, B3, my dear students. Don't get confused. Okay, B3. Okay. So vitamin B3 is also called as niacin. What is that called as? Niacin. What are the 4 Ds we are going to get in the pelgra? We are going to get Casal necklace. Casal necklace is a symptom of pelgra. Now, pelgra will have diarrhea, right? The patient will also have dementia. Okay, dementia. Okay, and dermatitis, that is inflammation of the skin. So this dermatitis will manifest as a cassal necklace. Okay, now most importantly, if deficiency is not treated, it can also lead to death. So that is why we call it as a 4D disease. Okay, so that is cassal necklace is seen with pelgra. Pelgra will have 4Ds: diarrhea, dementia, dermatitis, and death. So death is not a clinical feature which is given in the exam usually. Usually they are going to confuse you with these three options. So remember, so this is the, okay, this is the symptoms. Okay, now niacin is produced by which amino acid? This is also a very important. Why? Because listen to me, produced by which amino acid? Because within the human body, niacin is produced. So if niacin is being produced, you need to remember how exactly, from which amino acid? Produced by tryptophan. Produced by which amino acid? Tryptophan. What is the name of the amino acid? Tryptophan. So please listen to me. Produced by tryptophan. So if there is a deficiency of tryptophan, okay, again a tryptophan, if it is a deficiency, that will also lead to pellagra. And this is also a previously asked question within last 2 years itself. If a patient is having tryptophan deficiency, which vitamin deficiency? Tryptophan deficiency will lead to B3 deficiency. B3 deficiency will lead to what? Yes, importantly, that is pellagra. So that is the story. Now B12, B6 and B12 के बारे में little bit let's see. So B2 deficiency बच्चों, B2 deficiency. Okay, so I will write the vitamin deficiency, which vitamin deficiency and disease name. Okay, because this is some of the question which has been commonly asked about. So that is only for vitamin deficiency and disease, especially in the options given, it is a confusing. So let's start off with the vitamin B2. Vitamin B2 is a vitamin which is leading to deficiency, lead to angular stomatitis. It lead to which condition? Angular stomatitis. Angular stomatitis means inflammation in the corners of the mouth, my dear students. Angular stomatitis means what? Inflammation in the corners of the mouth. So that's only word angular stomatitis. All right. So we have other conditions, others to be remembered. So what are the other we have? I have given one vitamin, that is your vitamin B6 deficiency. B6 deficiency will lead to sideroblastic anemia. Sideroblastic anemia. Sideroblastic anemia. And sideroblastic anemia, along with that, it will also lead to peripheral neuropathy. Peripheral neuropathy. But the interesting scenario, peripheral neuropathy is also seen in which condition? Also seen if there is an excess of vitamin B6. If there is an excess of vitamin B6. So, as this is a peripheral neuropathy, will be seen with both of them. That is not ciliitis. Ciliosis is a better term. Okay. Don't get confused. That's it. Okay. Excessive also, basics excessive will also lead to what is that? Sideroblastic anemia. Deficiency will also lead to the same thing. And my dear students, B12 I have given in the options. So B12, if there is a deficiency, it will lead to megaloblastic anemia. It will lead to megaloblastic anemia. It will lead to megaloblastic anemia. Okay. And one more important point, the patient will develop neurological symptoms. Okay. Neurological symptom. Why neurological symptoms will be occurred? Because nervous system requires which vitamin? B12 for the synthesis of what? Myelin. If myelin is not there, automatically patient will develop the neurological symptoms. Okay. Now, along with that, one confusing point is there. Many students will think, sir, this is seen with B12 or B9, we are not sure. So this is only called as hypersegmented neutrophil. Which one? Hypersegmented neutrophil. Now please don't get confused. Hypersegmented neutrophil is a symptom which can be seen with B12, B9 deficiency also, because B9 will also cause megaloblastic anemia. B9 will also cause megaloblastic anemia. Okay, and also this will also have what is that? Neutrophil. Which type of neutrophil? Hypersegmented neutrophil. So hypersegmented neutrophil is commonly seen with both of the vitamin B9 and B12. So both of them will lead to megaloblastic anemia. So one symptom you are going to utilize here is what is that? Neurological symptoms. And one more thing which can be given in your blood parameters as a what is elevated. So in B12, remember, usually we will have increase of two substances, homocysteine, okay, and also there is a severe increase of MMA. Okay, it is not mixed martial arts, it is the methyl malanoic acid. Okay, but B9 deficiency, there will be only increase of one substance, increase of homocysteine. But what is that? Only increase of homocysteine will be present with which one? Will be present with B9 deficiency. Both of them will be elevated with what? That will be elevated with the B12 deficiency. That is the story of your very importantly, that is B9 and B12 differentiating factor. Okay, then let's go to the next one. That is your what enzyme is deficient in von Gieger's disease. Okay, that is GSD type 1. What is that? GSD type 1. So glycogen storage disease, maybe last year if they haven't asked, you might be thinking they will not ask at all. Understand one thing, glycogen storage disease is such a type of common question which is asked. You'll always will have one or the other question. Okay, so that is why please don't get confused. Okay, which enzyme deficiency occurs in one Gieger's disease? The enzyme deficiency is very good. Absolutely, people are correct. Whoever said the A as an answer, glucose 6-phosphatase deficiency will lead to which one? Glucose 6-phosphatase deficiency will lead to von Gieger's disease. Debranching enzyme will lead to Cory's disease. Deficiency lead to Cory's disease. Branching enzyme deficiency will lead to which disease? Anderson disease. Branching enzyme deficiency lead to Anderson's disease, right? And glycogen phosphorylase. So it can be in two locations, which you need to remember whether it is muscle, right, or whether it is in the liver. Okay, that is liver. If there is a deficiency of glycogen phosphorylase, that will lead to Her's disease, my dear student. Which disease? Her's disease. Which disease? Her's disease. Okay, muscle, if there is a glycogen phosphorylase deficiency, it will lead to McArdle's disease. McArdle's disease. Which disease? McArdle's disease. Okay, so then there is one more enzyme deficiency, acid maltase deficiency. Okay, acid maltase deficiency will lead to Pompey's disease. Will lead to which disease? Pompey's disease. So these are the glycogen phosphorus storage deficiencies which are commonly asked. In the class, I have told you A, B, C, D. A for Anderson, B for branching enzyme deficiency, C for Cory's disease, D for debranching enzyme deficiency, M for muscle, M for McArdle. Liver you can remember it as a hepatic means in the liver. H for hepatic, H for Her's disease. Okay, you need to remember all of this. Very good. Whoever told me Pompey's disease will be deficiency of acid maltase. Okay, which of the pathway is defective in G6PD deficiency? Okay, so what is G6PD? That is glucose 6 phosphate dehydrogenase. Okay, this glucose 6 phosphate dehydrogenase, whatever is there, my dear student, this glucose 6 phosphate dehydrogenase is the rate limiting enzyme of which pathway? Rate limiting enzyme of HMP shunt. Which shunt? HMP shunt. Okay, so which enzyme deficiency? G6PD deficiency will lead to defect in the HMP shunt. Okay, so please understand, beta oxidation is for the fat oxidation. It is for the fat oxidation. The location of beta oxidation will occur always in the mitochondria. It will occur in the mitochondria. Okay, so it is a rate limiting enzyme. So HMP shunt, HMP pathway is responsible for what? HMP pathway will gives two important products which you must remember. What are the two important products? So one is NADPH. One is NADPH. Okay, not NADH, my dear students, NADPH. Okay, and also HMP pathway will give you ribose sugar, Okay, so this ribose sugar is responsible for nucleotide synthesis. Okay, and one more, NADPH is responsible for, it will remove the free radical in the RBC. Okay, where free radical in the RBC, that is red blood cell. Okay, simple. Let's go. Okay, what is that? Very easy to understand. There is a decrease of G6PD. If there is a decrease of G6PD, automatically there is a decrease of NADPH. If there is a decrease of NADPH, anybody see, normally NADPH is responsible for removing the free radical in the red blood cell. If it is not there, there is no removal of free radicals, so automatically increase of free radicals. So increase of free radicals where bacho? Free radicals in the red blood cell. Increase of free radicals in the red blood. So if there is an increase of free radical in the red blood cell, that will lead to hemolysis. And important key points to be remembered. So in the G6PD deficiency, you are going to get two important findings which you must remember. One is, my dear students, Heinz body. So if I was supposed to set, for example, question on Heinz body, I will not give where do you see Heinz body. I'll give a question. Heinz body is made out of what? Heinz body is a type of lipid peroxide body. Heinz body is a type of lipid peroxide body. This is a point to be remembered. It's a type of, what is that? Lipid peroxide body. Okay. Then because these Heinz bodies will be removed by your spleen, right? Splenic macrophages. Removing the Heinz bodies, it will also give rise to bite cells, bacho. Which cells? Bite cell. It will also give rise to bite cell. So Heinz bodies, bite cell, okay. And symptoms of the hemolysis usually will not be there in a healthy individual. But when they get more of free radicals, the hemolysis will also become more in a G6PD deficient patient. If free radicals are less, symptoms will also be less. That is why after taking anti-malarial, more of free radical, more damage to the RBC. So during the consumption of old anti-malarial drug, if the person already has a G6PD deficiency, the hemolysis symptoms will become more aggressively visible. All right. So I hope everybody understood this concept. Let's go to the next one. That is, which vitamin act as a cofactor for transamination reaction? Okay. So bite cell is made out of lipid. Bite cell is not made out of bacho. This is a good question. So who is that? So Dr. Kasana Tarun. Okay. So now listen to me very carefully. You have a red blood cell. You have itself a red blood cell. Okay, you have itself a red blood cell. Now on the red blood cell, there is a, just one second guys, there is a something happened. My comment box got closed. Just I'm opening it. Okay, so just one second. One second. Okay, perfect. Sometimes it happens, technical issue. Okay, now on the red blood cell, more free radicals were in the red blood cell. More free radical will come and react with the react with the cell membrane, creating a Heinz body. Now this Heinz body, whatever is there, Heinz body will be removed by the macrophage. So in the spleen, macrophage will take the Heinz body. So after removing that one, the remaining part of the RBC, after removal of the red blood cell, whatever is there, it will create like that. So this cell we will call it as a bite cell. Okay, so I hope you understood this. So what is bite cell? Bite cell is made out of what? Bite cell is made out of RBC only after the removal of the Heinz body. So removal of the Heinz body will do what? Bite cell creation. I hope it is clear. Okay, so let's go to the next one. Which vitamin act as a cofactor for the transamination reaction? You people are already given the answer. Very good. The answer is your vitamin B6. Is a direct fact-based question. So transamination reaction is a reaction which will play a role in the urea synthesis. So basically from the organs such as muscles and the brain, the transfer of ammonia from one amino acid to another amino acid, we will call it as a transamination. So transamination will require your vitamin B6 because the transamination requires an enzyme called as transaminase. The transaminase coenzyme cofactor is which one? Cofactor. So rather than cofactor, the better word we can use is coenzyme. The best word we can give is coenzyme. Okay, but when they are giving in a generalized statement, it is fine. Okay, yes, removal of the hands body creates the bites, that's it. Okay, and here, so coenzyme is vitamin B6. Let's go to the next one. Deficiency of homogentisate oxidase, okay, will lead to which disease? Homogentisate oxidase deficiency will lead to a disease called as alkaptonuria. It is a impaired metabolism or impaired breakdown of your, very importantly, which one? That is your tyrosine. Phenylketonuria is due to deficiency of mainly one enzyme, phenylalanine hydroxylase. Maple syrup urine disease is due to deficiency of branched chain keto acid dehydrogenase. Okay, so the answer is alkaptonuria. What is that? Alkaptonuria. Very good, bacho. Okay, let's go to the next ninth question. Amanita phalloides mushroom. Abhi tak Amanita phalloides they haven't asked, but there is a high possibility. So whenever we are speaking of Amanita phalloides mushroom, this is an enzyme. This is a poison which will come and inhibit the RNA polymerase. Which will inhibit the RNA polymerase. Okay, so if somebody had told the answer already, you're absolutely correct. But listen to me very carefully. So Amanita mushroom, Amanita phalloides will come and inhibit the RNA polymerase. If it will come and inhibit the RNA polymerase, this RNA polymerase will decrease the production of mRNA. RNA polymerase is not working, so it will decrease the production of mRNA. If there is a decreased production of mRNA, automatically that will lead to decrease of protein synthesis. Decrease of protein synthesis. So if there is a decrease of protein synthesis, bacho, automatically patient will start to develop the symptom because protein synthesis is decreased. Now listen to me very carefully. Body already has some protein. Body is working with that protein, but new proteins are not coming. For example, I have a patient who ingested the mushroom at 7 p.m. Who ingested the mushroom by mistakenly, accidentally at 7 p.m. At 7 p.m. when he ingested, so he will get the symptoms after 1.5 to 1.1 to 2 days later. 1 to 2 days. So what till 1 to 2 days, how body is having protein? Because already jo banaya hua tha, whatever which was previously made, that will work maybe for 1 to 2 days. Later only body will start to develop the deficiency. So patient will have a immediate symptoms of the mushroom poisoning or late symptom. That is a late symptom. This is a very important point. So Amanita phalloides is a late mushroom poisoning. Is a late mushroom poisoning. Okay, so for the late mushroom poisoning, what is the treatment? Now you tell me. So late mushroom poisoning is there. What is the treatment? सारे बच्चे बताओ. मैं बताया हूँ आपको क्लास में बताया हूँ. I have taught you people this in the class. Come on, tell me, when is this late mushroom? What is the treatment for this late mushroom poisoning? Everybody, come on quickly. Because this is a very important it's a very important question, very important and very commonly confused topic also. So what is the treatment? Come on, everybody, tell me. I'm waiting for your answer. What is the answer? So late mushroom poisoning, so symptomatic treatment, that's it. Symptomatic treatment. So no atropine, do not use atropine. No atropine. Remember this key point. You are not giving atropine. Okay, lavage karo, lavage bhi nahi ho payega. Symptomatic treatment you kar sakte ho, because one day before he has ingested, it would have got absorbed, right? lavage bhi karne. Immediately if he comes, of course we are going to do that. Okay, IV fluid, symptomatic treatment, that's it, management. Okay, no atropine. So only for which poisoning? Early mushroom poisoning. Early mushroom poisoning. Early mushroom poisoning is due to Amanita muscaria. Which mushroom? Amanita muscaria. So that time the treatment is your atropine. Atropine is a drug of choice for which condition? Yes, early mushroom poisoning. For late mushroom poisoning, no symptomatic treatment, and this is a very, very fundamentally important MCQ. Don't get confused. Okay, let's go to the last question. Which lipoprotein is cardioprotective? Okay, so well, the answer will be what is the answer? All of you know which is that. So that is HDL. HDL, what it is doing? Reverse cholesterol transport. Reverse cholesterol transport is done by your high density lipoprotein. Okay, so basically it is taking the cholesterol from the tissues and bringing it back into the liver for the metabolism. Very good, all of you are correct. HDL. Okay, so this is the discussion of your all other LDL, VLDL, IDL. All of them are, they are increasing the risk of atherosclerosis. So cardioprotective cholesterol mainly is your high density lipoprotein. So this is a story of your 10 most important questions. Okay, so you might be thinking, sir, these were a simple question. हमेशा के लिए एक बात याद रखिएगा, most of the people think sir every question is going to be complicated, every question complicated, 300 बनाना नहीं, examiner का पागल हो जाएगा. Remember, examiner will also has to apply the logic and make the paper. Okay, so your biochemistry question pattern usually within last 2 to 3 years is like this only. Okay, इतना ही simple बात है. Maybe 1 or 2 questions which will be there little complicated, but rest of them, if you have read the notes once, definitely you can solve them. So biochem, don't take it for granted. It will fetch you solid 12 to 13 marks. 12 to 13 marks is not less than FMGE exam. So understand the seriousness of this biochemistry. Okay, and some of you maybe get to meet me tomorrow in Delhi, probably in our class sessions. Okay, but anyways, so please understand, सर ये 10 ही क्वेश्चन पढ़ के जाओगे ऐसा नहीं होता है. आपको क्वेश्चन व्हेन यू आर रीडिंग आल्सो, द अप्रोच आई टुक फॉर सॉल्विंग द क्वेश्चन इज द सेम अप्रोच यू आर आल्सो नीड टू अप्लाई. ओके, डोंट थिंक लाइक अरे सर कुछ भी कर लेंगे, ऐसा नहीं होता है. You need to apply this pattern because see, when I solved one question, I just didn't do, I just went into the detail of that question in such a way that what are the surrounding possible questions which can be asked. ओके, वो भी करवा देंगे भाई, वो भी करवा देंगे, वो भी करवा दूंगा यार. ठीक है, फार्मा भी करवा दूंगा. फार्मा में 10 क्वेश्चन नहीं हो पाएगा मेरे से, मुझे थोड़ा टाइम ज्यादा चाहिए. वी विल डू 20 इंपॉर्टेंट क्वेश्चंस. ओके, आई विल टेक 20 इंपॉर्टेंट टॉपिक्स. ओके, और उसमें भी ऐसा करेंगे अपन, वी विल डू सच टाइप वे in that every question what are the key points which can be asked from that topic. I'll do that. Okay, वो भी करा देंगे, कोई दिक्कत नहीं. Okay, so that is a story of your 10 important questions. And आप अभी पढ़ रहे होंगे. Now I will not disturb your time. So these 10 questions are supposed to be crisp and concise manner. Now you can go and continue your study. सोने के लिए और पार्टी करने के लिए मत जाओ. Okay, बैठ के पढ़ो. Okay, we are getting closer to the exam. Okay, वो भी करा देंगे, वो भी लाइव होगा, क्यों नहीं. We will do that also. ठीक, आप लोग मांगे और हम मना क्यों करेंगे भाई, करवा देंगे. ठीक है, I will do it, no problem. Okay, all right, thank you so much guys. So let's not waste our time. So you know how to reach out to us. Okay, anybody has any doubts, anything, you can put it from my subjects, you can drop me a message. I'll leave my number also for you people. So just drop me a text or give me a call on Telegram or something. If you have doubts, you can contact me. So but don't waste your time. Okay, so study is hard, don't fear. डर आएगा, डरना चाहिए, it's absolutely fine. So डर के आगे जीते बोलते हैं. ओके, ऐसा डायलॉग 1000 बोल सकते हैं. अब तुम्हारा मन में कौन सी डायलॉग हो रहा है मुझे पता है. लीव बोलता है. Now listen to me. Being fear is an absolutely correct thing. Have a little bit of fear. Okay, that fear will drive you good to but with the fear not studying is not a logic बच्चों. Okay, sir मुझे डर क्या होगा, कुछ नहीं होगा उस दिन एग्जाम. See, this is written on the paper. One simple thing, you are going to sit in the exam, you are going to face the exam. When we know that for a fact, डरने से क्या होगा? कुछ नहीं होगा. Understand this. Okay, so we will feel that, sir, one subject when I'm studying I feel like other subject I forgot. That and all is fine, it's okay, it's a part of your journey. Okay, it's a part of your preparation. थोड़ा बहुत आएगा, उसको थोड़ा कंट्रोल में रखो. Try to control it. Okay, and one more thing I will tell you, you don't have to recite the whole notes. Understand this बच्चों, you do not have to completely 19 subject का notes वहां पे जाके वाइवा देने का जरूरत नहीं है. You have question in front of you, have 4 options, you have to choose out of what you studied, you have to choose the single possible best answer. Okay, so prepare your mind according to that only. Okay, don't think that immediately we are going to get this type of what is that like recalling the whole notes. Okay, that is just going to create more fear. Okay, अगर मैं बायोकेम पूरा टेक्स्ट बुक भी पढ़ लिया ना, कल मुझे आके सर ये पेज में क्या लिख के, मैं बोलूंगा कि भाई मुझे क्या पता यार, right? But if you ask me a question, then I will talk about the topic. Your brain also is trained like that. Okay, so that is one thing you need to remember. Don't fear, time manage करो, जितना possible हो सके उतना question solve करो. Okay, try to revise your notes much. Okay, and remember one thing, अरे एग्जाम हो जाएगा. एक तुम लोग सर 150 लाना बहुत अरे एग्जामिनर इज टेलिंग यू पीपल, अरे भाई 150 गलत कर फिर भी मैं तेरा पास कर दूंगी. ही इज टेलिंग यू, you make 150 mistakes, still I'll make you pass. Yes or no? Right? He's telling first question correct, second question wrong, third question correct. As every alternative question, if you make mistake also, I'll make you pass. He's telling. Look at it like that, right? So bring little bit of positivity towards you. Okay. So keep that confidence with you. We are with you throughout the journey. Okay. कुछ भी कभी भी help चाहिए, please ask us. We are here to guide you. Okay. So see you people. ये भी ज़्यादा lengthy motivation करने का चक्कर में आपका time waste नहीं होने दूंगा. So just focus on your studies. Whatever I told important things, remember that. See you people. Thank you so much. Good night. Bye bye. Spokojnej noche. Do svidania. Shubhratri.